My name is Marie Berlouis. I'm a CT2 in anaesthetics at NHS Ayrshire and Arran, and was part of a team that looked at the perioperative screening and testing of patients with unhealthy alcohol intake. High alcohol intake is associated with increased perioperative complications, with increased mortality and longer hospital stays. Therefore, effective preoperative screening for those with high alcohol intake is imperative as it allows good preoperative planning and encourages health promotion in the pre-surgical stage. However, over-investigation is not only burdensome financially, but also on the lab staff time and has an impact on patient experience. We therefore aim to evaluate our current practice of testing of LFTs and coags in patients who are identified as having a harmful alcohol intake and compare this to the recent guidance published by the Association of Anaesthetists in January of this year. Caldecott Guardian approval was granted, and we then did a virtual review of all those patients presenting to preoperative assessment in the month of August 2024. 442 patients were initially identified, with 412 patients included in the final analysis, 30 being excluded either due to missing data or not being asked about alcohol. Of this 412, 64 patients were identified as having a higher alcohol intake, and then split into the following groups. Low risk, with an alcohol score as per our screening tool of 5 to 9, hazardous, 10 to 14, and harmful, over 15. Analysis was primarily done in the low risk group due to patient numbers. What we found was that over half of these patients, 57%, undergoing LFT testing and a quarter of them undergoing coagulation screen testing. However, the vast majority, 86% and 80% respectively in the LFT and coags, were normal. Of those that were abnormal, 5 patients in the LFT group and 3 in the coag group. This had no change in the clinical management of this patient, with no further investigations, repeat blood tests, or referrals to other specialities in the hospital. So what does this mean? It suggests we are over-testing compared to national guidance, and that our current screening tool is not recommended for use. By changing to the Audit C screening tool and audit questionnaire, low-risk patients will not undergo routine LFT and coag testing, and therefore an opportunity to save over £4,500 per year. We've designed a new protocol for preoperative testing based on this and implemented the Audit C questionnaire. We plan to re-audit and compare our data and hopefully find that we have saved both time and money and better patient experience. Thank you.